to be here. It was really nice driving into Nottingham today because I used to live here, and in fact I used to go. I was at university and went to the York House building across the road. I remember having some of my first arguments about the ramp, so I'm really glad to see the ramp still there. That was great. So it's really nice to be here today. And as Ian said, my name is Sue North. I work for Contact a Family, and I'm the director for the Parent Carer Participation Programme. And today I'm just going to talk a little bit about some of the national developments that are going on in relation to the changes in the law around special educational needs and disability, following on from what Dawn was saying. And then also just to talk a little bit about kind of the national Parent Carer Participation Programme and what that means, which of course Rainbow Parent Carer Forum is part of. So we are going to try and use this fancy thing. Okay, so this is the national picture. So as Dawn said, for the last year we have been looking at a document called the Children and Families Bill, which proposed a new way of working to support children and young people with special educational needs and disabilities. And that came about really as the result of a whole range of work that had been done and responses from families and professionals that said the system as it was just didn't work. It was broken, it wasn't responsive to families' needs, and actually families were just sick of having to tell their stories again and again and to constantly have to be reassessed by lots of different agencies for the same kind of things. So the Children and Families Bill was an attempt to kind of address some of those issues and put into place a different system. And so the bill has been going through the parliamentary process for the last year. And when the bill first came out, there were quite a lot of responses about it, which I'm sure that you as a forum will have been involved in responding to. Because whilst it addressed some of those issues, there were also some concerns that the bill as it stood perhaps wasn't going to do everything that people would want it to do. And so it went through the House of Commons and then it went to the House of Lords. And in the House of Lords there were some quite significant changes made to the bill, which responded to some of the challenge that had been put forward from the disabled children's sector and from parent carers around different elements of the bill. And some of that was particularly in relation to whether disabled children were included or not. And there was a bit of an argument about, you know, what that meant and what it didn't mean, and if you talked about children with special educational needs, if they had a disability that meant they had a special educational need, would they be included anyway? But it was very worrying that because in the first stage it didn't include disabled children specifically, that did mean some children would not be included. So in the House of Lords, an amendment was made and disabled children are now included, not in all elements, but in a lot of the elements around the provision of support. So that was a positive move to look at that. Within the bill, as Dawn said, there's kind of some key changes really. So some of those changes are that statements will be replaced by education, health and care plans. And that was really a key response to all of those messages from parents saying we're sick of having multiple assessments and all of those things. So it's an attempt to try and pull together both the assessment process and the plan at the end of it. So for some children, their statements will become education, health and care plans. The process in which that will happen is likely to be a transitional process over the next 3 years, and we don't know yet. The Department for Education haven't yet issued the regulations around that transition. They're hoping to do that very shortly, but the plan at the moment is that for any new children that come into the system that might need that support, that from September then that support would be provided through an education, health and care plan rather than a statement. And for those children that currently have a statement, that transition might be longer, and that might be over a 3-year kind of process that transition happens. That's also the same for young people that have learning disability assessments. So those assessments as well will transition into education, health and care plans. So some of the other key things that are quite important is around the age that young people will be supported from. So again, lots of the messages from parents and carers was that, you know, at 18, it's kind of like this huge cliff edge and what happens. So the new Act enables that education, health and care plan to sustain now until a young person is 25 if they remain in educational training. So that won't be for everybody, but that will be for those young people that still need that plan to support them to meet the outcomes that they need for their lives in their education and training. And that's also the other really key change within the bill, is that it's about trying to help young people achieve the outcomes that they want and they need for their lives, rather than perhaps being driven by educational achievements or specific tasks. It's really trying to be much more holistic in looking at what's important for and what's important to young people and children as they go through this process, and what education, health and social care can do to support that. The other change that's quite significant is that School Action and School Action Plus will also change. And so that will change into a single category called SEN support. So the resource that has been there to support School Action and School Action Plus will remain, so the schools still have that same level of budget, but instead of having those titles of School Action and School Action Plus, there will just be one SEN support, and there will be a change in the way I guess that schools may look at that and work. But the message is still that that support is there for young people that need it, that might not have an education, health and care plan, but who still need some additional support for their special educational needs in school. And there's been quite a lot of debate and concern and worry over that. And I think that there's been some people have had some concerns that the resource that was there for School Action Plus will go or has gone, and that's not right. So if schools are talking to you in those terms, then that's not accurate, and you need to perhaps ask them to go back and talk to their LEAs and the leads in the local authority to help be clear about what that is. And one of the other key changes, which again the one Annie talked about, is about the local offer. So again, the development of the local offer is about having a resource that is available for parent carers to know what is available to support your child who may have an additional need or a special educational need or disability in Nottingham City or in your surrounding areas if you live near the edges by the county. And we've had some areas that have been pathfinders, so trialling it out and seeing what this might look like, because there's not a kind of one size fits all for what the local offer should be. But the department are quite clear about what the local offer shouldn't be, so they're quite clear that what it isn't or shouldn't just be is a list of these are these organisations that provide this. And I think in lots of areas, particularly from the Aiming High period, that's what we ended up with. We ended up with a bit of a directory of services of what was out there, which was helpful and useful, but actually the local offer should be more than that. So it should be clear around where are the thresholds and the eligibility criteria, because I'm sure that for many of you, you will have experienced those challenges of you phone somebody who says, well, your child's not eligible for this, try that. So you phone them and you say, well, no, it doesn't meet our criteria, try those. And you do that, and it's just that horrificness of having to do that regularly. So the local offer should alleviate some of that. But that's also why it's really important that parent carers are involved in developing the local offer, because it's got to be right and it's got to work. And it's got to work for you in your area here. So it's great that there are already parent carers on those development groups working on all of those strands here in Nottingham City. So there's a whole range of other changes that will come about with the Children and Families Bill, and we will shortly be publishing an information sheet for parent carers, and I'm sure within your forum you may have had access to other information as well, but I'm happy to talk to people at the end if that's helpful, and anybody would like to know a little bit more about that. So, as I said, the transitional period is likely to be over a 3-year period, but we will know more when the department publish the regulations and the guidance around that. And what we've also had over the last few years are huge changes in health. So we've had moves from PCTs to clinical commissioning groups and a whole range of other things that impact on our children and young people that really have quite significant impacts on their lives and their futures. So now we have clinical commissioning groups that commission services. We have health watches that have taken over from links. So they have a role in working with communities and working with service users in terms of monitoring how provision is working. We have health and wellbeing boards that have a strategic requirement, an overview of what's happening and plan the strategy for local areas. And then we've also had a range of different inquiries and things that have happened. And you're probably all familiar with the Francis inquiry, which was into the care of people in Stafford hospitals and how they were failed. We've had the Winterbourne inquiry into how those young adults who had learning disabilities were treated in their care home. And so following on from those, we've had a whole range of requirements and action planning and changes that have happened, that it's been really important that both locally and nationally, that again, parent carers and those that use services have had a real input to. And the national network of parent carer forums, which local parent carer forums input into, have been involved in all of those elements of work. So there's lots going on. There's lots going on in education, there's lots going on in social care, there's lots going on in health, and then we've also got all of the efficiencies that are being made everywhere in relation to budgets. But the thing that is key to all of those changes is the fact that the involvement of parent carers and the involvement of disabled children and young people is at the heart of the changes. And Edward Timpson is the minister that's responsible for these changes in the Department for Education. And he attended the last national parent carer participation event, and he said, both there and in a video that he helped us produce that explains why it's so important, that involving parents is at the heart of the change. So you just have to hold on to that all the time, because it's just crucial. If we want the changes to work, that involvement is just vital. And although we are in an era of efficiencies, there is actually some resource that is attached to these reforms, and that in itself is an indication, really, I guess, of the importance that the department are putting onto these changes. So already the department have awarded £70 million to local authorities across England to help them with their implementation, and it's likely that there will be other funding announced shortly to also support. So, when you're working with your partners, it's helpful to make sure they're aware of that and are reminded of that additional investment. The Department for Education have also increased funding to support parent carer forums over this next year. And that's a really welcome increase, because although the department have funded parent carer forums for 6 years now, it's £10,000, which sounds a fair amount, but actually when you're running a forum for thousands of parents across an authority, it's really not a whole lot of money. So they've increased that to £15,000 for this next year, so that's great for every local forum. They've also commissioned a whole range of providers, of which Contact a Family are one, and the National Network of Parent Care Forums are another, to support the reforms and that reform process. And in each region there is also a Pathfinder champion who will be supporting and sharing their learning from having implemented these changes in an earlier stage than everybody else.